A common question that customers have when selecting portable units is about the sound of the dental system itself. Controlling the sound varies widely between grades of dental units out there. This unit has been designed for quiet operation and to minimize vibration. I'll go ahead and run the suction handpiece so you can hear it. You hear the sound of the vacuum motor running, but it is still less noise than the actual HVE running. Now I'll run a handpiece so you can hear the sound. You hear the compressor running. It's approximately the same volume as the high-speed handpiece. We also aim to minimize vibration to the chassis for you to have a stable handpiece holder bar without the handpieces vibrating. It's important to consider the performance and how the handpieces and suction operate when comparing portable dental systems. ASI uses two independent pumps. The air compressor is contained in the upper compartment to run your handpieces and pressurize your air-water syringe. The lower compartment has a separate vacuum pump dedicated to running your suction handpieces. The independent pumps are necessary because you want them to be powered equally and not compromise each other if they're both running. Other units have reduced overall performance because they use a single pump for suction and compressed air. We want to gauge the compressor performance by running the handpiece drill at full pressure. You should be able to see your gauge and run your handpiece at full torque without losing RPMs. The other thing to consider for a portable dental unit is electric handpieces, since they consume less air and give you considerable cutting torque. The vacuum is one of the more complex things to recreate in a portable system. Measure the vacuum performance in two ways. One is vacuum strength, which is how hard the suction pulls against your finger. We want that to be moderate because if it's too strong, it can bruise the soft tissues of the tongue and cheek. The second measurement we want to use is high airflow, which is the amount of aerosols and things like that high volume can pick up. It's also necessary when using a high volume and a saliva ejector simultaneously. You need to have enough airflow for the saliva ejector to work while they're both open. I'll now demonstrate the high volume. You can see that it works quickly and clears the jar rapidly, comparable to your in-office suction. What you want to do is have this open and run the saliva ejector. The water on the tray is to show how your saliva ejector would work drying the inside of the oral cavity or behind the rubber dam. The ASI system is powerful for a mobile portable unit and gives you suction strength comparable to what you would have with an in-office system.